Good day, ladies and gentlemen, and welcome to the pre-course practice session hosted by Jackie Linton. My name is Emma, and I'm your event manager. During the presentation, your lines will remain on listen only. If you require assistance at any time, please key star and 0 on your telephone, and a coordinator will be happy to assist you. I would like to advise all parties this conference is being recorded for replay purposes, and I would like to hand over to Jackie. Please go ahead.
Oh, hello, everybody. I think we've got quite a few people on the call. My name's Jackie Linton. I'm part of the Horizons team. I'm just really excited to welcome everybody on the practice session today. I hope that you get lots out of it. I hope you're able to connect on the day as well. And I hope that we'll be able to sort of answer all your questions. So this is just a warm welcome, and I'm hoping to join you next week. And I just think that this is just an exciting time to be able to join in the School for Health and Care Radicals, wherever you are in the world. So I'm going to now hand over back to Paul Woodley, who will take you through the next steps. So well done, everybody, for getting to this stage, and we'll see you on Friday. Okay, thank you. Bye.
Good morning all, and welcome from Paul Woodley. This session's being run to welcome everyone to the school first and foremost, and to give you all a crash course on the use of WebEx. Some of you may be familiar with the system, others may not, so we'll do this in stages to make sure everyone's familiar. If at any point you've got any questions, please post a message in the chat box. So to test that, first of all, could I ask that everyone puts a note in there to say who they are and where they're from? The chat box, for those of you who aren't familiar with it, appears in the bottom right-hand corner of the screen. That's it. Thank you very much. I can see then we've got someone from we've got Victoria from Sunderland, Joe from Macmillan Cancer Support, Kenwin, I hope I pronounced that correctly, from Denmark. So welcome. That's good. So if during the course of this session, if you have any queries, if you post them in there, I'll pick them up as soon as I see them. Okay. The other way, if you need to try and get my attention for any reason, we also have the ability to raise people's hands, and we may ask this to see if you're following and if you agree with statements when we run any of the training sessions. The option to raise your hand can be seen just to the right of the screen above the chat panel. And could I ask if people could raise their hands when they found that button? Oh, right, okay. I can see there's a couple of comments that have come in now that people aren't seeing all the responses. If you post a message that you want everyone in the session to see, could you please change the send to all attendees? If you send it to all the panelists, only those people in this section will be able to see it. So if you'd like to share something or have a conversation with everyone, then please post it to all attendees. The panelist, if you send it to all panelists, that's useful in that all of those presenting and all of the people directly involved behind the scenes will all see it. So if you have any technical issues or any very involved things that you'd like to ask, send it to that. But if you'd like to get conversations going with your fellow delegates, please send it to all attendees. Okay, I'm seeing a couple of people have said some of these functions have not been activated. It may be that we haven't activated them, so that might be an oversight on our part, which is partly why we're having these sessions, to make sure we get everything set up. our event manager, who's Emma, on this session. I'm going to ask her if she could check if people have got the ability to raise their hands and send messages to all attendees. Okay, right. Bear with me 1 second. I'm just going to send a message through to the host so I can get them to activate your ability to raise hands. Okay, yeah, thank you for that. I can see all the comments that are coming in. I've now sent a message through to the event manager, the host, to ask them to provide you with access for this. So until that comes through, perfect. The activated hand should now be available for everybody. I can see you've all got it now. That's wonderful. Okay, that's great. That's quite useful when we're running any of these sessions. If we're talking about things, we want to see how people feel, whether or not they agree with a premise. We'll ask you maybe just as a straw poll to put your hand up in this way. If I ask you to put your hands down again, then to put your hand down, just click the button again. The other way that we can do polling, if we're going through and we want to see how people feel on an issue, we can actually run a poll. And I'll start one now, a very basic poll, just to see that everybody gets it. This will now be open for a minute and will appear where the chat box currently is. And once the results come through, I'll share the results with everybody. The polling should now be open for everyone in the panel to the right. Okay, looking at somebody else's screen, I can see it hasn't appeared. Emma, I'm checking other people's screens and they can't see the poll yet.
Yeah, I'm just trying to sort that out for you, Paul.
Thank you.
It's started now.
Okay, wonderful, thank you. Now I can see that everyone can see it. I can see that just about everybody has access to it now. Okay, the hands up button appears if within the participant panel. So if you open the participant panel, this is to do with the hand raising again. If you open the participant panel, so if it's collapsed, there'll be a small arrow just to the left of where it says participants. If you click on that, that will open the panel, and then you should see the hand symbol, which will appear just to the right of the arrow I've just drawn. So for those people who haven't seen it yet, has that helped you all? That's great, thank you. And I can now say that we've only got 4 people who haven't answered the poll, and the poll time's ended, so I'll now share the results with all of you. And you should now see, providing your poll option is open, your poll panel is open, you should now see the bar graph of results. So it keeps it anonymous, so we don't know who's voted what, but it just, if we're asking for any feedback, second, that's just double checking it showed up. Okay, it may just be taking a second to share those results with you. Emma, can you double check that, please? I've told it to share the results and apply it.
Yeah, have you clicked the individual results at the bottom? If you click that,
poll results.
if you click, you need to click the individual results, and that will give you all the results of the poll.
Okay, it wasn't okay then. How do I share it so that everybody can see the bar chart?
Yeah, so if you click, sorry, I'm just trying, because you're sharing your screen now, I just need to go back. At the bottom, where it says poll results and individual results, and then you would you click apply. I think because it's closed now, because the poll's closed, you've gone past that. So next time, if you click both of those boxes, and it'll say apply, show, and it'll show the whole bar chart.
I only wanted to share the bar chart, which is why I'd only clicked poll results and then clicked apply on that one.
I'll double check that for you, Paul.
Okay, if we can double check. Can people see them now? I think people might be able to see it. It might have just taken a while to replicate the details over. So I'll thank everyone else who's on the chat for the patience while we're just double checking these features, but we want to make sure we get this right for you, and that's why we're having this test session now. That's great. I can see now that people can see the bar chart. That's great. Okay, I'm going to close the poll option down now then, and move on with it. If any of the panels along the right-hand side collapse while we're running these various features, there is an arrow next to each of them, and if you need to open them up again, you can just click on them. So if anything does temporarily disappear, that's how you get it all back. Can I just ask if anyone's got any direct questions so far to post them in the box?
Thanks for that. Cheers.
That's great. Okay, I can see that there aren't any questions so far. If that does change, though, feel free to just post them or put your hand up at any point. Someone just asked if they can only see their own name of the participants panel. That is correct for now. There is an option. We can see all the attendees at this end, but for now, to help streamline the way the results are presented, you'll only see your own name. I think when people put their hands up, they'll all appear. You'll see more people appearing then.
Jodie's got to find out what has been sent to her.
Okay. I can see that some people are still struggling to see the all attendees option in the send to list. Could people put their hands up if they still can't see the all attendees option in the send to options under the chat? Okay, I can see then that it would appear the majority of people still can't send to all attendees. Emma, has that been activated yet, or should that have been activated yet?
I'm just double checking for you, Paul.
Thank you. Okay. While Emma's checking that, the other way that we'll do a Q&A session is we will ask if you'd like to address your question directly to any of the panellists. The way we do that with these calls, we'll invite you to speak, which I won't tell Emma comes back before we do all of this section, but what you'll do is if you press *1 on your phone, you'll then be put into a holding queue, ready to speak to the BT operator, will then put your query forward to us. So Emma, could you let me know when you're available again, and then we'll run a test Q&A session for people.
Of course, Paul. As regard to the chat, is something that we needed to do at the beginning before the call started. So the next time you run the call, it's Friday, isn't it? If you just say to the operator that you want everybody to be able to chat to each other, and then we can do tick the actual thing in the background that we need to, so that that option is available for everybody.
That's great. Okay, I know that, and I'll make sure that we've set that up ready for Friday's session.
Yep.
And I hope that's okay with everybody on the call.
And would you like me to open for Q&A?
Yes, if you could do, please.
Certainly. Ladies and gentlemen, your question and answer session will now begin. If you wish to ask a question, please key star then 1 on your telephone, record your name, and then press the hash key. If you then decide to withdraw your question, simply key star then 2. All questions will be answered in the order received, and you will be advised when to ask your question, and all other lines will remain on listen only. So just to remind you, if you wish to ask a question, key star then 1 on your telephone, record your name, and then press the hash key.
Okay, the Q&A session is now available. So if anyone does have anything that they'd like to say, would they be able to press star 1 now so that they can see how the system works?
Okay, Paul, we do have a couple of questions coming through. The first question comes from the line of
Joe.
Please go ahead, you're live in the call.
Hello.
Hello, Joe. Nice to speak to you.
Nice to speak to you too. This is really exciting. I've never done this before.
Oh, that's what we try and run it for, to give everyone this opportunity.
Thank you. I really appreciate it. I just basically wanted to ask if today's session is going to run for the whole hour and just what the timing is going to be like for the sessions going ahead.
Okay, today's session, because it's primarily a testing system to make sure everyone's computers have the compatibility to use the WebEx platform, and so people know how it works, we can end this session sooner, or if you have other things that you need to get to, we won't be offended if you want to leave early. I will probably leave the session open for the full length in case other people have had problems joining, to make sure they don't miss the opportunities to join in.
Sure.
But if people want to leave early when they've tested everything they need to do, then you're welcome to just leave, and I hope it's been helpful to you.
Oh, yeah, it's definitely very helpful. And then the sessions going ahead are an hour and a half, is that right?
That's right, yes. The sessions will start at 9:30 a.m. Greenwich Mean Time on a Friday morning, and they will run until 11 a.m.
Okay.
Those sessions will also be recorded, and we'll be uploading the recordings, and they'll be made available to everyone who's joined the sessions, or who has registered on the website, rather.
Right,
and the link will be sent out to everybody through the News from Joe, which comes out twice a week.
Okay, brilliant. All right, great. Thank you very much. So what do I do now? That's my question done.
That's okay. Thank you very much for that.
Thank you.
Okay, your next question comes from the line of
Kynwyn Giron.
Please go ahead, you're live in the call.
Oh, hi there. This is quite exciting for me. I'm calling from Western Australia, on the south coast of Western Australia.
Welcome then.
Thank you. Because we sort of live and work quite remotely, we're sort of quite used to doing our business in this way. This is sort of how we do our medicine, never mind how we do our learning. So yes, so this is really cool. Thanks for the opportunity to participate.
No, these things only work because of contributions from people like yourself. So we welcome you being able to join on anything like this, and we encourage any participation you have. It's the same way that we also use a lot of conversations we try and encourage to happen through Twitter, because that way, where people are in a different time zone like yourself, it's not limited to individual session times. If you post something up using the hashtag SHCR, anyone who's following these conversations will be able to pick up on it. So it doesn't just have to be someone within the team who are running the program who responds to you. We would encourage anyone who's taking part in this as a learning exercise. If they have the relevant experience, please join in, and we would encourage any of the group support and group learning, because that way we can learn from you as well as you learning from us.
Excellent. Yes, I use your hashtag. There's an 8-hour time difference between you and us, so I'm 8 hours ahead of you. It's 7:22 in the evening here, I would like to participate in your live Twitter sessions, but unfortunately they're at an hour when I will probably be asleep.
I can't blame you for that at all. But if there is anything, if you feel that you are missing out and you need more in-depth conversations, you've got the Radicals email address as well, which is advertised as part of the news from Joe. So if you do have any questions, please send it through to that, and we'll make a point of making sure we get back to you with that and answer any queries you may have.
Brilliant, thank you. It's been good so far.
That's great to hear.
Thank you. Your next question comes from the line of
Lisa Statham.
Please go ahead. You're live in the call.
Oh, hi. I'm Lisa, calling from Devon.
Hi, Lisa.
I just posed a question really just to see how it works.
Oh, no, that's great.
But the only thing I was going to ask was, is there any formal assessment to the course at all?
There isn't a formal assessment. Upon the end of the course, we will send out a questionnaire to find out what you've learned, how you've applied it, and things like that. But it won't be an onerous exercise, and it won't be under test conditions. We want people to take part in this to get benefit. But if you're joining because you want to encounter the wider improvement community, then that's a worthwhile exercise. So we wouldn't say that you failed just because that was all you wanted to get from the program. If that's what you want to get, that as a goal is absolutely fine. Other people who want to develop an existing element of learning, maybe build upon something they already know, they might then have different answers to yours. There isn't a right and wrong with this. We've deliberately left this so it's quite open-ended because we want to accommodate as many people from as many different walks as we can.
Right. Okay, that sounds very inclusive.
We do try.
Thank you very much.
Okay.
Okay, thank you. Your next question comes from the line of
Paul Kendrick.
Please go ahead. You're live in the call.
Hi, Paul.
Hi. Like most people, I think we were just testing the features, but thank you. I'm finding this interesting and certainly slightly different to my previous experience of WebEx. We use a particular meeting center version, so this event center is certainly different and well worth the technical run-through. I suppose I just wanted to know, as it's a technical run-through and most of the interesting questions have been asked, the full client, I'm using the web version because I think it had to install something. Do you know if it has to install something? And if not, I was just going to suggest, Paul, I'd try and do it as you're going to keep the system open for the full hour after the meeting. So does it need the full client as I'm just using the web version?
Okay. The web version should be absolutely fine. If you can see the screen where we're sharing the slides, you can see the chat, you're not missing out on anything. So if you can see everything already, then that's fine. I think if you download and install the additional bit of software, it will just make connecting smoother and a bit faster for you. And then if people are sharing video, it might enable the streaming to go a bit faster for you.
Okay.
But you don't need to do it. If it works okay anyway, that's the main point.
So it may be a bit faster, and my experience has been the system would phone me back. So this one you do actually have to phone in yourself directly.
On this one.
Okay, that's. I want to make sure anybody, because I'm trying to do a group learning session, so I'm going to make sure people know those differences because we're obviously used to our own WebEx, so this is slightly different for us. And that was good. Was it our colleague was from Australia? Is that correct?
Yes, Western Australia, I believe.
Happy Australia Day. I think it was recently. So okay, that was my parting shot. Thank you. Happy Australia Day.
Yeah, no, that's great. Thank you for that.
Cheers.
And it looks like you were correct as well, Paul.
Okay, thank you. Your next question comes from the line of
Jane Parr.
Please go ahead. You're live in the call.
Hello, it's Jane Parr here from Leicestershire. I was just an absolute technical novice, so enjoying this very much. I just wanted to ask about Twitter. I'm a novice on that as well, and whether you could recommend any good guidelines on how to use it.
Sorry, can you say that one again?
Oh, I was asking about Twitter guidelines, if there's anything to help me use it more effectively. I can do the basics, but like messaging someone and stuff like that and joining in the chats. Is there some guidelines on that?
I'm sure there are some guidelines for that, and we'll be able to find them for you. We'll put the link into the next newsletter from Joe on Tuesday, if you'd like.
That's lovely, yeah.
If that's helpful, yeah, and then we'll see if we can get it added to the website, maybe as a useful resource for people.
That's great, yeah. I've got lots to learn, as well as all the data that's coming out from this. It's all the technical stuff as well, isn't it? So it'd be great.
That's great. Yeah, and a couple of people now have posted up and let me know that we nurses have a good infographic about tweeting guidelines as well. So we'll try and share that link with everybody.
Okay, that's brilliant. Okay, thank you very much then.
Thank you for your question.
Bye.
Okay, your next question comes from the line of
Jazz.
Please go ahead, you're live in the call.
Hi there, hello everybody. My name's Jazz. I'm just testing this. This is incredibly exciting. I've got 2 questions, if that's all right.
Of course, that's fine.
Thanks. Well, I'm a GP, but I'm on a sort of an extended career break at the moment. I'm not really sort of in touch locally with anybody. I've not really been able to form a team despite trying. Is that going to be okay for me, just to sort of join in as an individual, or?
Yes. It's absolutely fine for you to be able to join as an individual. It's the group exercises are an optional extra to try and give you something additional in the programme. But there may be some of the groups that get started will be working together on a virtual basis. And if you put a request through to us in the Radicals mailbox that you'd like to be part of a virtual group, we'll try and put you in touch with those other people.
Oh, that would be fantastic, because yeah, I mean, I'd really like to get as much out of this as I possibly can. I think it's like a really exciting opportunity. I think I'd read somewhere before, or somebody had mentioned to me about a possible mentorship, especially because I'm sort of unemployed at the moment, as it were. Is that something that's on offer with your school?
Yes, the mentoring is, when people register, we ask them to let us know whether or not they'd be interested in either mentoring or receiving a mentor.
Okay.
So at the moment we're collating those results to try and put people together.
Oh, fantastic. Okay. I'll double check that. I'll definitely let you know that that's what I want then.
Yeah. As again with everything else, once we have all those things sorted out and finalised, we'll share all the details of that through the news from Joe. So basically what we'll try and do is, if you know that anything that comes out when anything is produced, we'll always put the links and share it and announce it through the news from Joe. That way you know there's only one place you need to keep going to check for.
Wonderful. Great. And the last thing, is there anything else, anything more technical just for today's session, or is that it once we've asked our question?
That today, I think, is pretty much it. I've tried to go through all the basics. There is a whiteboard option which would allow people to illustrate points if they want to do drawing, and you can ask other people to be involved. But I don't know if that's definitely going to be involved. So the important bit is the chat.
Okay.
Making sure you can join in and being able to see the slides, because we will be doing a lot of the presentations on the slides themselves, and they'll be talking them through, and they'll have examples and things like that. So if you can see the chat, and we will make sure that you've got the ability to chat amongst yourselves for the next session, because that's something we need to change in the way these meetings are set up.
Okay. Okay, well, thank you ever so much. It's really exciting. Okay, goodbye, everybody. Bye.
Thank you for your time.
Thank you, bye.
Okay, thank you. Your next question comes from the line of
Pete.
Please go ahead, you're live in the call.
Hi, it's Pete Jackson here in Telford, and I've
Hi,
joined the conversation late, so I'm just trying to catch up on what I've missed. And all I've got on my screen is obviously the telephone instruction page, and I can see chat that like I've posted a couple of questions myself, but I can't see anything that anybody else is chatting about.
No, that's to do with, that's a mistake on our part. I'll hold my hands up to that one. It's when we set up the session, we didn't realise we had to specify that we provide the ability for the individual attendees to chat amongst themselves and to post to the entire group. We thought it was a default option, it wasn't, so that's learning on our part. So that will be corrected in time for Friday to make sure. If you see on your chat panel, there is a list, an option to send to a drop-down list. One of the options on Friday will be to send to all attendees.
Attendees. Okay. So in terms of the previous, presumably there's been some previous slides this morning, and am I able to access them or? All right.
The slides today, most of this has been done as more of an interactive exercise. I've been getting people to test putting their hands up, posting questions on the chat. I ran a brief poll. Were you on the call at the poll time?
No, I wasn't, but I saw the poll was there, but it was closed when I joined.
Okay. I will very quickly just start that and see if I can. I'm not sure. Emma, would we be able to rerun that poll?
I can rebuild it and you can rerun it if that's okay, if you'd like.
Yeah, if we can do that then. If people have already done it once and feel that they've got everything they need from this session, then once we've finished the Q&A session, if you would like to leave, then that's absolutely fine, and thank you for your time this morning. Anyone that's either joined late or would like to go through the polling again, then please feel free to stay on, and after this session, we'll rerun it. Is that okay for you?
Yes. Yep.
That'd be great. Okay. Was there anything else you wanted to ask, Pete?
Just in terms of, I work in local government, and I'm just, sometimes our systems don't necessarily tie up, so I'm actually doing this from home, and I was just wanting to check about the telephone call, dial-in, and charging, etc. Whether that's affected at all by using my landline at home.
It isn't. There are two numbers on the invitation that went out. One is, well, there's for a UK caller, rather, there are two numbers that we share with you. One of which is the UK free phone number, and one of which is a direct line number. The direct line number will charge you a local rate call.
Right.
The free phone line will obviously give you the free phone option.
Okay.
We share both with you because if you're calling from a mobile, mobiles can't always dial into free phone lines, in which case it might work out cheaper for you to use the local rate call line.
Yeah, yeah.
That's why we share both with you.
No, I get that, yeah.
And then for those people who are calling in internationally, there is a link to a global dial-in list because we can't put all of the global dial-in details. So we provide an international direct line to call into, and then the global call-in lines also provide a local rate call, and I believe there might be a free phone line for some of the countries as well, for wherever they are in the world.
Yeah, and I'm using my desktop, but what's the situation in terms of using tablets or iPhone?
Tablets should work absolutely fine. I know the Apple tablet works, and I believe the others do. Emma will be able to correct me if I'm wrong on any of this. Right. Laptops, PCs should all be fine on it. There shouldn't be any limit. I haven't tried it myself on an iPhone or a smartphone, so I don't promise people, but I believe other people have used it. In fact, could I ask if people through the chat, if people are on through a tablet or a mobile phone on this session? Okay, no one's come through. But Emma, would you be able to answer this question? Because this is more of a technical question, knowing what the capabilities and accessibility to this system is.
Sorry, can you repeat the question? Because I was just building your poll.
Yeah, no, that's fine. Pete, would you like to repeat
it? Just about the question about use of tablets, iPad, or iPhone to join the conversation, and whether there's any pros and cons, or is it best to be using your the desktop?
I think you can use either, to be honest.
Yeah.
It just depends if you're using your like an iPad or a tablet on how strong your signal is, to be honest.
Yeah. Is there any requirement to use camera?
Stripey.
There isn't a requirement to use camera. Some of the panelists, when they are presenting, Helen Bevan, for instance, tends to prefer to share her video image so people can see who's talking to you. Yeah. So when she's presenting, she'll probably choose to share her camera, and her camera image will appear in the top right of the screen if you are on a PC or laptop and a screen of that size.
Yeah.
It may appear somewhere different if you view it through a smartphone screen or a tablet screen.
Okay.
I'm currently, because I'm in the office, I'm working on a desktop, so I can't describe the exact layout on other people's software, but you should be able to view it on all of them.
Okay, that's great. Thanks, Paul.
Okay.
Yeah.
So thank you for that.
Okay, Paul, we have no more current questions. Your next poll is built, if you would like to start that.
Okay, I will just reopen the poll for anybody who missed it the first time or would like again. Let's see, let's go with open the poll now. Now, for those of you who didn't see it the first time, the poll should now have opened where the chat box was. And this is timed to be open for a minute, but if everybody responds sooner than that, then I can close the poll down. Okay, there are 6 people who haven't responded to the poll yet, and we have 22 people who have responded. Okay, the last 5 seconds of the poll is open now. Okay, it's just collating the results for us at the moment. Okay, the poll's now closed. 24 of 28 attendees responded, and I'll share those results up with you. You should see them all shortly. Yep, they should. Okay, can you all see them now? If people put a note into the chat. For those people who need to leave, then thank you very much for your time this morning. I hope it's been helpful. That's it. And I can see people were able to use the poll this time round again. Okay, for those 2 people who've responded as a maybe, the poll will basically be used if during the sessions, if we want to see whether people agree on a premise, if there are multiple ways that we can tackle a problem, or different suggested approaches, we may try and take a poll in this way to find out where the group decide. That's all this will be used for. It's to get an idea and a feedback from the group on your opinions on things. The questions won't be too complex for anybody. The poll will be open at most for 5 minutes for people to respond to. It's just to get a good idea so that when we're talking to you, we can get a steer on how well what we're talking about is resonating with yourselves. Okay then, I can see there's a few people who've still got their hands up. There's a couple of people who've actually got their hand up as well with the attention tracking with an exclamation mark. If those people have got a question, would you like to post it within the chat box?
I haven't told them. I've still got mine on. I've not told them.
Okay, I can see the hands disappearing. In which case, okay, that's great. No, that's people who are just testing it to see how well the polling system works. Okay, if there is nothing else then, or if there are any other sessions, the School for Health and Care Radicals, it will be run on 5 90-minute webinars, each of which are run on a Friday morning, starting at 9:30 AM Greenwich Mean Time. There will be a tweet chat on Wednesday afternoon, but as we say, if you're using the hashtag of SCHR, then whenever you post it, someone will try and respond to you. or there is an option of emailing us, and I'll just quickly post in the chat box for people the email address for them again. And if you have any queries at any point, or you'd like to speak to us directly, if you send an email through to this, then someone in the team will respond to you as soon as possible. We've got a thanks to Healthcare Improvement Scotland, whose WebEx package we are currently presenting on. So thank you for sorting this out for us. And I apologise, I just mistyped the hashtag. It's SHCR. The website, which you'll all know about anyway because you've all registered, and the 5 sessions are up on screen now for everybody, and the links to the events will be sent out through the News from Joe every week. So I hope this session's been helpful. If you do have any more queries, please post them in the chat, and I'll keep this session running until 12 o'clock, but I'll stop presenting unless anyone has anything to ask. So thank you all for your time.
Okay, thank you, ladies and gentlemen. The audio part of your conference today has now come to a conclusion. You may now disconnect. Thank you for joining and enjoy the rest of your day.